So we are going thank you. We are going to invite you today. Can we get the first slide? Thank you. Well, hopefully. Okay. This is something we are very proud of, and you are seeing the debut of several years of research and grant writing and hard work and research that has come to put together the first of 5 modules that are part of an innovative grant funded by the Rehabilitation Services Administration, given to the University of Memphis Institute on Disability in 2020. Excuse me, 2020, right? Okay, they got that right. We're going to end in 2024, 2019 to 2024. That 5-year period, perhaps even with an extension. We're waiting to hear on that to do more data changing and information improvement. But this really started back in 2014 with the first meeting of what is now called the Vocational Rehabilitation Counseling Coalition, the VRCC. People got together from back then about 14 rehabilitation organizations. The initial meeting was funded by the International Association of Rehabilitation Professionals. We met in Chicago, and we've been meeting ever since, which is a long time for coalitions of professional groups to meet. And what was identified way back in 2014 is the lack of data and information to be able to make a case for why what we do in the field of rehabilitation and disability makes a difference. We know we're doing really good stuff, but how do we prove that? How do we demonstrate that to important people like Congress and stakeholders and the people who care about people with disabilities getting competitive integrative employment? And so the seed was sown at that very first meeting that there needed to be focused research in this area that was outcome based, not just, oh, we feel really good when we look at these things or when we teach about these things or when we do these things, but actually looking at outcome based research and saying we need to prove that what we're doing makes a difference, and we need to know what it is about what we're doing that makes a difference in the lives of customers and people with disabilities. So that's kind of how the concept was initiated at that first what is now called the VRCC meeting. It was supported especially by the National Rehabilitation Counseling Association as an important piece of research. And I really want to thank the folks that were on the board back then for writing very strongly in favor of getting the funded research, which did begin in 2019. We'll give you the right dates. And will end in 2024 or hopefully even 2025 if we're lucky. So we have a ways to go, but not much yet. We're close to the end of putting this together formally, but outcome-based research isn't going away. So whether we're funded with it or not, the research will continue because this is where it's really at. Outcome-based. Does it make a difference? Do people really get good jobs? Not just we feel good when we work with them. So that's not going to go away whether there's funding or not. And this is a piece that actually didn't come from the basic research that we started. The piece you're going to see today was an add-on, but it's an important add-on, and especially because that first meeting in 2014 was a response to WIOA. And WIOA is what brought us what we now call PREETS or pre-employment training services. So way back in the beginning, the idea of working with customers and clients early in their lives from the age of 14 through transition to whatever the next step is after high school was an important part of what we wanted to get outcome-based data on. So this piece that you're going to look at today and going to get one CRCC CEU for for reviewing with us, is an outcome of the request from the Rehabilitation Services Administration to make this an understandable concept for customers, for counselors, for those of us that work with people with disabilities in any capacity, to really understand what it is that happens when we do what is now called pre-ETS training. Of course, in 2014, it wasn't called that. There had to be a name created for it, but it did come from the 2014 WIOA Act. So that's kind of where we're starting. The staff tells me that after this, we will be able to bring you 4 more CEUs of credit for your help in our getting feedback on the 4 outcomes that are based on outcome-based research. And in order, they will be crisis and trauma interventions, which will be in January, career development and job placement also in January, and then hopefully in February or early March, a unit on medical and psychosocial aspects of chronic illness and disability, and a unit on healthcare and disability management. And again, I really want to thank both the VRCC and especially NRCA, which was part of the VRCC back in those early days, for helping us push this agenda to better understand how we serve our customers by outcome-based research. So I'm going to talk for just a few minutes about the module itself and what you're going to see in it. And then I am going to go away, and you're going to get the rest of your 1 hour, the rest of the hour, by actually looking at the product. And then you're going to get your CEU credit by clicking on a link, doing a very short evaluation of the module, and then magically this CEU credit will appear on your screen and you can print it off. So that's kind of what's going to happen. I'm not going to talk for a whole hour today. I'm going to talk for a few minutes about why we're doing this, as I have been, where we're going to go with it in the future. And then I'm going to let you experience the module. Now, understand that today you don't have to pass the module. We're not evaluating you. You are evaluating the module. So you don't, at the end of this, you don't have to take the test that will be attached to the module when it actually goes out to CSAVR or whoever is going to use it, or the public in general, or pre-service training programs, whoever wants to use it. There will be a test connected to that people will have to pass with 80% efficiency. But we're not ready to put that test on there yet, because we want to see that we've really put everything into this module that needs to be in it. And we want your feedback on whether it's easy to use, how it looks, if it's pretty or not pretty, where it could be improved. So all we're asking you to do for the CEU is to go through the module with one link, which will be sent to you immediately after I stop talking. And then the second link, when you push it, you'll fill out the evaluation, and immediately the CEU will pop up on your screen for you to print off. And then hopefully you'll have so much fun doing that you will want to do it with us for the other 4 modules that are connected to the actual outcome-based research. And for those of you that couldn't be with us today, if you have friends that want 1 to 5 CEUs, we're going to be doing a webcast version of this, where it won't be live like we are today, but people will hear me talking, and they will get the link for the unit, and they will get the link for the CEU, and that'll be available in early February. So all of you who are currently on will get information about that to pass on to your friends that are interested in actually taking the module and giving us feedback. For the person who's driving, let me tell you, you don't have to do it immediately. We are going to keep the webinar link open until Friday the 8th, this Friday the 8th, till 4:30. So if you have something really important to do when I stop talking, you will be getting your 2 links. If you don't want to do them right today, you will still get your credit if you turn them in before 4:30 on Friday, December 8th. So you got a little time. especially the person who's driving, probably a good idea to go park somewhere and do it. My understanding you can either do it on your phone or on a regular computer, but safety is really important. So we hope that that's attended to. And for those of you that just want to get it out of the way, just do it and get it out of the way, and you will get your immediate gratification. Okay, so that's kind of what's happening. Let's go to the next. These are very few slides. So I think what I've explained to you is why we're doing what we're doing today. The pre-ETS module is part of what's called Project First. Project First is the federally funded grant, and the product of the research are these 5 modules. And conceptually, they could be used in many different ways. They could be used in pre-service or in-service training for vocational rehabilitation. They could be used in a community rehabilitation program that is delivering services or wants to deliver better services. But the overall outcome, and that's what RSA has paid us for, is that if you have the information, which we have obtained by very rigorous research. We have 25,000 cases in our study and data from counselors in 4 different states at this point, and with a variety of diversity among the counselors and huge diversity among the clients. That those outcomes will be boiled down into these training modules that you'll be able to take, or that friends of yours can take, or that colleagues of yours can take, however they end up being used in the public domain. They'll also be archived in the training center clearinghouse for training materials. They'll be on our website. So this all belongs to you. It's in the public domain. It's not something that belongs to the Institute on Disability. It's meant to be used. But when those modules are out there, they can be used at any time and in any way to enhance the field and to bring people up to par on these 4 predictors of success in outcome-based research, in getting people competitive integrative employment, and in better understanding pre-ETS employment transition services. So that's kind of what it's about. So go to the next slide. So we'll start talking a little bit about pre-employment training services, and then we'll let you go ahead and do the module and evaluate it. But pre-ETS is a partnership between vocational rehabilitation and high schools, because it's taught in the high schools. Can't do it without the support of the high schools. But it is something that's been in the Rehabilitation Act. The idea that we could do this has been in the Rehab Act since the 73 Act, at least, if not sooner than that. That it is possible to work with customers as young as 14. So this is not new. It didn't just appear in WIOA. What changed was the focus and directing money towards that population. The goal is to provide career-focused services, and those include, and these are very clearly described in the program, the materials that are to be taught: job exploration, work-based learning, workplace readiness, self-advocacy, which we find, and some of you know that we have a program, an inclusive higher education program here at the University of Memphis Institute on Disability, and working with a population that's transitioning out of high school into work. And self-advocacy is really one of the most important parts of all of this, because there really isn't any place else that anybody teaches these youth and young adults with disabilities to advocate for themselves. I mean, the world is kind of has them and manipulates them, and this is a chance for them to say, no, this is what I want. This is what I think I want to do when I transition out of high school. This is where I want to go. So the self-advocacy part of this is really important, as with the counseling about, and these are your options once you get out. So post-secondary counseling, what do you do when you leave high school? And then helping them actually make a decision, enrollment assistance, so that they can make a choice and move in that direction. If the direction is to go to work, making sure that they are clients of Voc Rehab and that they have their counselor helping them to get competitive integrative employment. If they're going to go on to a post-secondary training program like an inclusive higher education or a skills program or further education, how do we help them get linked to that? How do they make that decision and then implement that decision? And then are they ready to even do that? Are they ready to even think about that? And these are things that I think for students without disabilities is just like part of what goes on in their lives. But I think that almost anybody could benefit from this program. I mean, it's focused on young people with disabilities. But actually, if all of us had exposure to job exploration, work-based learning, workplace readiness, develop the ability to advocate for ourselves, and having someone help us counsel into those decisions and then get enrolled in them, we probably would be in pretty good shape when we made our career decisions. So while it's focused on this group and it's part of the federal act, the stuff that's taught here is really good stuff for anybody who's looking towards a transition to work. Next slide, please. Okay. So one of the things that's really important is collaboration among professionals and service systems. And this is a quote from, or taken from Paul Wayman, one of the gurus on transition, that the important components of effective programming to support school to work and adult-like transitions is this preparation that we're talking about. Actually working with people, not just assuming that they're getting it in high school, not just assuming that their families are giving it to them, not just assuming that they're getting it from their peers, although those are all good sources. I mean, parents should be giving them ideas, peers should be giving them ideas, teachers should be, but how do we know that they actually have exposure to those things that are taught in a pre-eds program so that they can make a good, informed, self-advocated decision about what they're going to do for the rest of their lives, or at least the first job that they're going to do, because then that counseling becomes a continuous thing, especially if they're clients of vocational rehabilitation. Previous research on Voc Rehab is focused on role and function of services, and now we are looking at pre-service people who are clients of vocational rehabilitation, but who are preparing to transition, not yet at the moment of looking for employment. And that's a little different too. As I said, it's been in the law for 50 years at least, if not longer, but we really didn't focus on it until 2014 and after that. Okay, next slide. Okay, so what should that pathway look like? This is part of encouraging involvement. We start with 14 in the middle school and go through high school, and then perhaps to a university program, a community college program, a training program. How do we get into career opportunities? That transition should be as smooth for young people with disabilities as it is for any person in transition from high school to what the next step is. And sometimes people don't have a smooth transition. This is a nice picture that kind of flows from left to right and it's real smooth, but we all know from our own career experiences that it isn't always that smooth. Sometimes you start in a program and it turns out it's not the right one. You need to stop and you need to rethink and maybe start a different program. Sometimes people right at the point of high school are not yet ready to make that jump into the world of work, and they need some support in getting there. They need to be trained in self-advocacy. They need to know what jobs are out there. I mean, there's a million jobs. You only see maybe 20 or 30 jobs if you're watching TV. You know, the ones that have a lot of visibility, police, SWAT, teachers, nurses, doctors. There's lots of jobs out there that people are not, young people are not exposed to unless we actually talk about what is in the world of work with them and what are the things that they could do. And sometimes, especially those clients that have intellectual disabilities, are not exposed to very much. They're leading pretty sheltered lives because the families are taking care of them, and maybe they haven't thought about the fact that they may want to go to work, and they haven't really taken the care that they might take with their with their children who do not have disabilities, to really talk about what's the next step. So in this sense, we're doing an intervention and helping that conversation get started between the child, the young adult, and the family. Next slide. Okay, so as I've said about 15 times, signed into law in 2014, but not that you could work with people at 14 to 22, but signed into a more formal way, a dedicated way within the WIOA Act. I'm not sure that overwhelmed is exactly the right word to use, but since this wasn't something that many of the voc rehab counselors that have been in the system for years were used to, I would say that it was another added piece to the work that they were already doing, and sometimes that can feel like a real burden. And so it becomes a cooperative activity between the VR counselor and the community rehabilitation professionals and the teachers in some of the locations, because sometimes this is taught by staff at the school, and sometimes it's taught by dedicated PREATS trainers who have to go through a training program to be trainers for this. But however it is, it's a partnership. Some of that burden is being taken away from the VR counselor by the trainers, whether it's high school staff or CRP, community rehabilitation professional staff, doing the training. So that adds another dimension to it for the students. I think sometimes if it's an outside person coming in, it gives them a different perspective, a different look at the world of work and what's going to come next. And because this isn't something that was pushed before 2014, not all vocational rehabilitation counselors have training in rehabilitation counseling, which is why we've created the other 4 modules to help those people get to speed. But they haven't necessarily worked with 14-year-olds or 15-year-olds or 16-year-olds before. If they are VR counselors that have been in the system for a long time, they're probably used to working with adults, maybe only people that are leaving college or have already worked or something like that. So it's a different approach. And if we say overwhelmed, it's not in a negative way. It was just adding a new piece to a caseload that in most cases is pretty high. And how do we get around to doing that? So let's go to the next slide. So Project First is the name of the grant that we have. The objectives are to address the shortage of qualified counselors and pre-ed specialists, to make jobs easier by creating innovative, data-driven, effective, evidence-based modules, which if you hang in with us for the other 4 credits, you'll get to see the first drafts of. And to involve a greater audience, which is why many of you on the Zoom today are not just VR counselors or just service delivery professionals, but people that work with people with disabilities at all ages, are connected to the big picture on how to move people through to self-advocacy and decision-making. Go ahead, next slide. Okay, so the bridge module is the first of 5 modules. And the bridge, we called it bridge because it's bringing students with intellectual and developmental disabilities from school to work and into adult life. This is focused on the IDD population because that is the population that we work with. It's the population that the grant was willing to fund, and also because it's a population that often doesn't get a lot of additional support in the high school in terms of jobs and looking for work. But everything that's in here applies to every young person with a disability. So even though it's focused on intellectual disabilities, anything in this module could be used with a student with a physical disability, a psychological disability, sensory disabilities, etc. It's this training module is self-administering, and what we're asking you to do is not take it and pass it, but give us feedback on what we need to do to make it really fun and interesting and good for the people who ultimately will have to take it and pass it. Okay, go ahead. Okay, so here are your 2 links. And Kaylee is going to, we're right at our halfway point, which is where we're supposed to be. Kaylee is going to put the links into the chat, and they're on the screen. And she's also going to be emailing them to you immediately after I stop talking. So to get the CEU, you need to click on one. Look at the modules. You don't have to pass them, but look through the presentation, and then complete a short feedback survey and click your button to get the CEU. And that is pretty much what there is to this. We have a reference page, and before we actually send you off on getting the experience of the bridge module and the CEU, are there any questions from the group? Any of the staff, Patrick, Kaylee, do you want to comment on things that I left out or that should be shared before we send people off to do the second half hour and get their credit?
I just wanted to say thank you very much for everyone for attending. And just to clarify, we're going to be sending an email to you so that you'll easily be able to get on the links. I do think the module is going to require you to pass the quiz inside of it. So I don't think it's going to let you move forward until you actually score an 80. If I recall correctly, there is a test in the module, but you'll get there and find out. The content is pretty self-explanatory. So if it is there, then challenge yourself to get a score over 80. But yeah, once and then once that's complete, when you go to that the evaluation piece, the CEU is the last page. So you go through, answer all the questions. The last page will have the CEU to be downloaded. And I just want to make sure we're clear on where it's at. Thank you.
I mean, but let's be clear, nobody is looking at your score. We don't care how well you do. No, you're here to give us feedback. We don't care whether you pass it or how well you pass it. We're wanting your feedback.
The evaluation is really more important to us because that's asking the questions. Was the module interactive enough? Was it challenging? Was there things that you'd like to see that could be added? We left a comment box at the end, so you can go ahead and write a comment in. So we're really more interested in the evaluation piece. So we are the actual taking of the exam in the module.
And Kaylee, do you have any comments?
No, I put both of the links for the actual module and then for the survey to give feedback. I put those both in the chat, but I will send it out in an email right after we hop off as well, so that you have access to that after we close out of the meeting.
And if you have any issues, you all have Kaylee's email and you'll have it to get back to her if something's not working. We actually have the graphic designer with us, Kevin Thorne. Kevin, did you want to say anything about this?
Good luck.
Did you have a good time doing it? Do you know more about disability and rehabilitation, having worked on the project?
Yes.
Good. So we've even reached out to the world of graphic design.
Well, the one thing about being an instructional designer developer, you get to learn as you build and as you design and develop. So I've learned a great deal.
Good.
Really proud to be part of this.
Okay.
Kevin, I want to pitch. Kevin has done an excellent job developing, especially this Priets one. It's very innovative in our scope. And the other modules that we're working on right now, he's doing a great job. And I just want to say thank you publicly for all your hard work on this, and I appreciate your collaboration.
Thank you.
Yeah, and the modules, each of them is designed to be about a half hour because we didn't want to burden the persons who are taking it in the future. It's meant to be a screening device. It's meant to tell you this is basic information that you need to know and to direct you to where you go to get more information. And each of these things is like if I were teaching a course here at the university, they'd be a whole semester course on each of them. So obviously we can't put everything into a half hour, but we've done our best to get it down to the bottom line of what you need to know. And it's meant to be a way for the person who's taking the modules to then design a self-exploration program for themselves and say, oh, I knew this, but I sure didn't know that, or boy, I need to look into this, etc. With the feedback. So unless there are any other comments.
Miss Cliff has her hand up.
Okay.
Miss Christina?
Hey, thank you guys. Just a quick question. When we're doing the modules, if we run into any accessibility issues, would that be a comment for Kaylee or for Kevin? I don't think I'll run into, but just in case.
So
Well,
in the
I value that we need that kind of feedback, and we'll take the comment to Kaylee will take the comments, but we will work with Kevin to make sure we overcome any accessibility issues, because this isn't going to be any good for anybody if everybody cannot take it and make use of it. So if there are accessibility issues, we'll take the comments, but we will work with Kevin Thorne to make sure we overcome any limitations.
Mhm.
Awesome.
Yeah,
Thanks.
there's a box whenever you actually go to provide feedback at the end of the survey, there's a comment box. So feel free to put in there what accessibility concerns you had, or any
Okay.
that wasn't previously in the questions. Feel free to put it there and we'll be able to see that.
Okay, will do.
Okay, so go forth and enjoy. I hope you have fun with it. As I said, you will have from now, and it should take you just the other half of this hour to do everything else. But if you don't have the other half hour right now, you can wait. You can do it anytime between now, morning, noon, or night until 4:30 on the 8th, which is Friday. If you can't do it at all, or if you want to bring other people in, and we'd like hundreds of people to look at this and give us feedback so that we come out with the best product, you will all get an email, an invitation in February for a non-live version of this, so you can go back and do it then, or you can have your friends do it then. And then there will be 4 more units for one CEU for each of the 4 units that were based on the outcome-based research. So thank you all very much.
We have one more thing. We had somebody in chat, Miss Fisher, or Dr. Fisher said, are we now on the mailing list for future modules? And Kaylee replied, yes, that's in the chat. So just in case. So what we'll be doing is we have all your emails now. Now we can reach you. We will be sending these out as we're getting ready to do the live events. And then as the webcasts are going to come out as well, we'll head and resend that, so that can be forwarded out to your colleagues who potentially couldn't make the live event. And Dr. Geis kind of gave you a rough outline. We'd like to do a couple live events in January, do a couple of the webcast in February, and have this really wrapped up by March, with everyone having an opportunity to view all the modules and the same type of format, half-an-hour conversation that give you the opportunity to go ahead and take the module and provide feedback in the evaluation. So I just want to let everyone know, yes, you are now in our listserv that we will be forwarding stuff out to everybody. Thank you.
Okay, thank you all very much, and I hope you enjoy it. Give us the feedback.
Thank you.
Thank you.